Okay, so we're going to be going over the COVID pre-screening test. We're doing these to collect samples, and obviously paperwork is an important component. So sometimes it's coming to us pre-filled out, but otherwise our pre-admission screening has highlighted the sections that are important: name, age, sex, date of birth, and that is all that needs to be completed for that. That's going to be going with the sample. Then you get the sample bag. The sample bag is pretty simple. It only has 3 components. It has the swab stick, the collection vial, and the directions. Now, the directions will be there, but the only thing that's applied to us today is step 7, and that's what we're actually going over in the video. So if you want to read the directions, you can, but it's just step 7. Now, I also included, for this purpose, the wrong swab stick. And the reason why I point that out is because some of these kits are coming to us with the wrong swab stick. Instead of the oral one that is thick and fuzzy, some of them are coming with the nasal one, which is skinny and has a much tougher, tight bristle. Okay? If that's the one you have, you're not supposed to be using that one. So you need to get a sample kit, a kit that is a thicker one. So clearly a big difference between the two, and you don't want to use this one for the throat swab that we're doing because we're not able to get enough sample on there in order to ensure that it is a good swab and a good sample. Okay, so that's the nasopharyngeal one, and we're not doing nasopharyngeals. Okay, so this is our example, and we're now going to go ahead and do a specimen collection. So I'm going to take this, and we have Sergeant Verna who is helping us out. Now remember, you should be wearing iPro. You should be wearing your N95. I'm purposefully not wearing an N95 at the moment because it messes with the audio. But you need to be wearing the N95 because when we go to the back of the throat with this swab stick, it's a very pretty good chance that we could tickle the gag reflex, and then the patient is going to cough on you. So if they're going to be coughing on you, you definitely need to have iPro. You definitely need to have your all your PPE, your gown, and everything else to catch any droplets. So when we go ahead, it's best to actually be standing with your patient in a sitting position, and they can kind of look up at you and open the mouth all the way. And then what we're looking for is all the way back at the tonsillar pillars. So when we open up and we go in here, okay, so we're going in, I'm purposely coming into the side, all right, and if he drops his tongue a little bit more, there we go, and you can see the tonsillar pillars. You see the uvula down in the center, and then we're going to be coming right here, and right at the tonsillar pillars, I'm going to swirl. You see me swirling, left it right here, and then we come over to the other side, and swirl on the left, swirl, sorry, I know I'm obstructing my view a little bit, and coming out. And when we withdraw, we don't want to catch the tongue or the teeth if possible. That's simply going in. Can you go ahead and hold this for me now? All right, so without contaminating, without letting that touch, we're going to go ahead and open it up. Okay, it goes straight in. Now many of these, if you see like on the nasopharyngeal one, it actually has a score mark so that when you wiggle it back and forth, it breaks off, see? The other ones tend to have either a score mark way down low, or sometimes you actually have to cut them with a pair of trauma shears, or just keep going back and forth, and there you go, it dropped, and now it's in there, and we can seal it, and it goes in the bag. And that is it. That is your sample collection, and we're done.